And a few words at the beginning to the respiratory medicine. What is very important is this number. Basically, we know that respiratory infections are one of the most commonly seen in daily pediatric practice. It was shown that approximately 2/3 of all the infections in the primary care are connected with the respiratory system, but the crucial is the number that 85 to 95% of all the respiratory infections are caused by viruses. Unfortunately, in Slovakia, but also in some other European countries, there is usually incorrect and inappropriate indication for antibiotic treatment. There are certain surveys which show that approximately 80% of infections of lower airways are connected with prescription of antibiotics. So if you see that 95% are of viral infections, it's quite important to focus more on prevention and appropriate treatment, which can be also the immunomodulation. And we should be very precise in prescribing the antibiotic treatment for children. What we know is that high respiratory morbidity is typical for small age categories, and we have a lot of risk factors why it's quite obvious that small children are getting frequently ill. Among the most important, usually this is the question for my medical students, what do you think, what is the most important risk factor for a small child to getting ill? Since they know that I'm working with immunodeficiencies, so usually the first response is primary immunodeficiency, but unfortunately it's not this one. But we know that 3 most important cases are older sibling, daycare attendance center. Currently we have quite big problems because the children were isolated for several months, and currently they enter into the kindergarten or into the school collectives, and they should adapt to the microbial composition of the particular collective. And of course, innate immaturity of immune system is another typical contributing factor, because the immune system of small child needs some time for developing and needs some time for getting the capacity to be able to react appropriately in prevention of respiratory infections. So let's have a look on the typical characteristics of the immune system of the small children. We know that especially children during the first year of life, they have lower concentration of IgA, which is the most important immunoglobulin protecting the airways. There are some decreased concentration of complement. Complement is a part of the innate immunity. There is decreased immune memory, which should be built up by infections, by vaccination, and by immunomodulation. And small children are not able to respond to polysaccharides because the B lymphocytes are not able to produce antibodies, especially during the first 2 years of life. Therefore, small children are highly affected by, for example, pneumococcal infections, meningococcal infections, and so on. There are some other characteristics of the airways from the physiological point of view, where there is a high vascularization, soft mucosa, there is a predominance of parasympathicus. It means that during the viral infections, a lot of children you can see the wheezing because the parasympathicus is a little bit more active in small children. So taking into account the risk factors and the characteristics of immune system in small children, it's quite logical that the children will be a little bit more frequently ill compared to the older children. What is usually the most important question from the side of the parents? What number is normal? What number is acceptable regarding the respiratory infections? And we can distinguish between 2 important problems. One is the physiological respiratory morbidity, so it means that a certain number of respiratory infections can be considered to be physiological, especially in the small children. Especially those infections which are not complicated, which are only for several days, which do not cause any consequences after the infections. On the other hand, in small proportion of the children, we can see the true immunological diagnosis, which is the recurrent respiratory infection. So it means that in these children the morbidity is so high and so complicated that we should be a little bit more careful and to make some examination of immune system to exclude some other chronic condition and so on. So just short and brief characteristics of the physiological morbidity. It was shown that in small children, especially during the first 5 years of life, 6 to 8 episodes of upper airways infections, especially during the autumn and winter with mild course, without consequences, without the need for antibiotics prescription, can be considered as something physiological and normal. Of course, this is usually a matter of discussion with the parents because usually they are not satisfied with the number of 2 usually, but according to many studies, many surveys, 6 to 8 episodes can be considered something normal. For lower airways, is approximately 2 episodes for year can be considered as normal. So therefore, in those children with high morbidity, we can speak about the diagnosis, which is recurrent respiratory infections, and for younger children is more than 8, and for older is more than 6 episodes of upper airways. What is important is that between 6 to 8 there is a gray zone. You should be very careful in sense of the exclusion of immunodeficiency, allergic background, gastroesophageal reflex, and all the other conditions which can lead to the respiratory morbidity. So 4 cornerstones of the good functional immune system. Sleep and relax, this is very important. The child is not growing up during the sleep only, but also the immune system needs some time for relax and for improvement of its function. Exclusion of passive smoking, this is one of the most important preventive approaches in decreasing the risk of asthma. If the mother is smoking during the gravidity, it increases 15 times fold higher risk for child to be asthmatic later on. Of course, sufficient convalescence after infections is usually the mistake when the child are put back to the collective without the appropriate reconvalescence period. Usually the child will back at home with another infections within several days. And then we have vaccination and immunomodulation.